Jordan, how did you get connected with the Washington Fatherhood Council, which then led to some work that you did with them?
Yeah, they were on a list of organizations that was provided to me from the University of North Carolina, Chapel Hill, for completing a practicum, which is a required component for my Master's of Public Health, which I recently completed. I have my Master's of Public Health and my MD, medical doctor as well, and I'm licensed in Washington. What happened was I reached out to them and I spoke to Anne. She basically linked me up with all these folks in the Fatherhood Council, including Jose and others. It was a great experience. I worked on um, a screening tool. We were trying to capture issues that had not really been addressed for fathers at like WIC clinics, at primary care visits, family planning locations, and all sorts of questions were asked, on this on the initial version of this survey, and we updated it together with the team, and I took the lead and worked on it for about 2 or 3 months. And then once we thought it was in a polished format, we then took it to four different fathers. We had them take it, and then we basically asked them questions in a semi-structured um, feedback like interview, and then we recorded those interviews, and then we fed that information into AI, and we asked the AI, can you compare and contrast the reflections of these fathers and help us improve the tool? And then we took that information both from AI and like non-AI generated feedback, and we updated the tool. That was kind of where it stood, and it never really got like feet in terms of getting implemented because at that point my practicum was over. We did speak to a few folks like at the University of Washington when I was working on the practicum, and they were, I think, somewhat involved, but there was a lot of different moving parts, and I was, the new guy on the block, so I wasn't really sure exactly who everybody was, but I learned pretty quickly that in order to have a tool like this distributed widely across the state, it requires funding. There was a lot of issues with the staff, turnover as well. Um, so I know Anne left um, right after, my practicum. So I think those were some of the hindrances in terms of actually like getting it implemented. But I would like it to be rolled out, and I would like to, potentially be involved.
Okay. So creating a screening tool, a survey to give to dads to surface issues that might otherwise go unsurfaced. And then those issues can be dealt with in a variety of ways, but at least those issues would be better known, and then some recommendations for counseling or for classes or for any kinds of solutions to those problems could be put forth.
The questions were related to, like, a lot of it was related to drug and alcohol use, domestic violence, issues with marriage, um, issues with any legal issues. Really, it ran the gamut of anything and everything that a father or even a male 18 and older could face. Unemployment, mental health issues. So I think the tool is really valuable. I think it's different than what else is out there right now. Like when you go to your primary care doctor, and you have that checklist, it just doesn't really capture the male or father experience necessarily. And this is particularly geared towards that population. The idea is that it might need further redefining. It may still be a work in progress, but putting it out there and letting hundreds, if not thousands of people take it and then getting feedback on it could be really valuable to further refine it. But I think it just has to be put out there because it's better than what exists currently.
So getting the father screening tool implemented and used by hundreds or thousands of people, and then kind of studying how that goes, that would be like a phase two of a project that someone else would need to pick up ideally.
Yeah, in terms of funding, of course, when you have funding, then you have more options in terms of the kind of people that would take up the project, including, I think, University of Washington researchers are particularly apt at this type of project, that department that I was working with. But any organization that casts a wide net is going to be a great place to start because you need distribution networks, you need contacts, you need that social capital to unfurl this, potentially statewide, intervention. I think it has to take place at a governmental and potentially university level. You could also start with like a county, for instance, for to try it out and test it out. You could also start it at just one clinic. You could have a doctor or a nurse practitioner, or, PA, and just basically send it to them and say, as long as you're keeping things HIPAA compliant, test this out, see what your patients think about it. What's the result? What are the follow-up questions that you're getting? Is it helping? And going from there, just kind of on a smaller scale, kind of just have to jump in and start somewhere. Once it's being implemented, I think that it'll be quickly recognized that there is an unmet need that it's, tapping into. And so that will become evident. And so it'll become self-perpetuating, and other people will want to use it as a result.
What were y'all seeing that convinced you that there was a justification for a tool like this?
I came in when it had already been established that the need was there. The Washington Fatherhood Council has that information, and I'm sure they're able to share it in terms of data. Like there are definitely presentations that I read at the outset of my project, and it had all sorts of information in there, in terms of the unmet needs for fathers across the state, broken down by county, and age group. At the state level, they don't make any decisions without data. It's very important. So I was sort of like not so much like a data scientist. It was more of like um, kind of like human behavioral research, also on like how do people interpret questions. Like we wanted to make it very non-judgmental. We wanted to make it very accessible to people at a third grade reading level. So it was more about how can people answer the questions accurately and what questions need to be asked.
You are a dad yourself, and I'm curious if in the process of forming this screening tool, there were any reflections that surfaced for you of how you might answer these questions or how you or your peers, you could envision this being helpful.
Well, there were a lot of applicable questions across the board. I think this applies to, all fathers. I think there were questions about, stress levels, what are they experiencing? Are they getting any help? Do they have a friend that they can turn to when they have, issues? Those are questions that I think about, ask myself, almost every day. How do I create a better network between me and other fathers? Um, where do I get information, about like what to do, where to take my kid, how to educate my child, parenting skills. So we really, went into the specifics of not just the health and wellness and behaviors of the father, but how can their father, how can they be better fathers, actually? So it's pretty powerful stuff because the lives of fathers has been shown to be very important in the outcomes of their children. And so, I strive to be a better parent, and I think about, how can I be a better parent? So I do, like I have signed up for classes for learning more about like the psychology of children and parenting skills. I think, a lot of it as a result of my reflections working with the Fatherhood Council.
If money were no option and there was total political will and there was total belief by everyone in the systems necessary that like, oh, this is a great survey that we want to implement, this father screening tool, what would they come up with where they would say, well, we're already doing this similar thing. So all it is just adding this additional thing to it, no big deal. In other words, like what is the point where that survey would be implemented? And is there something where it's like, well, at that same point, but for women, for mothers, we're already doing this thing. So what we're asking for is something similar, but for fathers.
Well, I'll give you kind of an example from my master's paper that I just wrote on alcohol use during preconception in fathers and how it may be related to fetal alcohol spectrum disorder. There are approaches that are being used to help women with alcohol cessation and prevent alcohol consumption during pregnancy in women. And so the question I asked myself was in the paper was, how do these approaches translate to be used in the male population? What I concluded was that the male population not they not only disengage themselves from the medical community because of sort of like this machismo of like, I'm fine, I don't need to see a doctor, I don't need resources, I can figure it out on my own. But also the medical system eschews or ignores men, especially when it comes to pregnancy and it comes to conception, and also emotional needs that they might have, like mental health issues as well. It tends to sort of set them aside and ignore their needs. So it's sort of this like two-part, process of reduced access to care for men. And so with the screening tool, I think what we're doing is we're first going to men and we're recognizing their challenges are different than the challenges women face. And we're using the tool in a way to basically kind of make an emotional connection with men by letting them know we care. Okay, that like we care about the results of this survey, and we're gonna not only do we care, but we're gonna do something about it because so many surveys are provided to men and to people, and you don't get any feedback. We wanted men to understand that they would get feedback, they would get resources from this tool. We didn't build the AI, which we wanted to, because I ran out of time, and I think the state ran out of money to basically gather information based on the responses of the tool and then provide that to each father, in terms of resources that they could use to follow up that were validated, that were like actually accurate, resources and not like, here you go, here's like call 20 different phone numbers, but just like, here's one number, start with them and go from there. There's a lot of similarities between men and women. I think they're a lot more similar than they are different. But we're trying to address the need of fathers and directly try to address why fathers are not their needs are not being addressed, both because of their lack of participation in their own healthcare and the lack of the healthcare system adaptability to fathers' needs as well.
If I were to become a first-time father in the next year, and this father screening tool were already widespread, at what point would I encounter it?
Yeah, you could get it. You could potentially see it, like I had mentioned, prenatal counseling visit.
This prenatal visit, is that something that happens for most babies and dads?
So yeah, again, that I'm going to reflect on my master's paper. So I don't have like statistics, but I can tell you that the prenatal visits are geared towards women. Men are, according to ICD-10 codes, um, billing purposes, men are allowed and can be and providers can bill for visits by men for prenatal counseling. But the issue is that prenatal counselors don't emphasize the need for men to be involved in the prenatal counseling visit. And they don't follow up with the men. They don't schedule according to men's, work schedules. And there isn't a lot of um, male positive literature out there. Like when you get to the clinic, there's an image of a pregnant woman on the front instead of like a family, or there's images on the walls of, women and children, but then there's no men there in the images. So it's not being projected as like a sort of a couple's environment. So that's one of the issues. But yes, you can potentially go to a prenatal counseling visit on your own or with your partner and get information even before your partner is pregnant. Because the last time that males had any interaction regarding sexual health is actually during sex ed in high school. And really, after that, there really isn't any education for males after that. And men don't really talk about sexual health with their peers. It's just not really discussed, nor is contraception. Like women tend to talk about things like that with other women, but men don't. And that's just, kind of societal more than behavioral. It's just kind of how, as a society, we function.